I want to bring to you a friend. I want to bring to you someone who's very close in this industry from NACADA. Her name is Cynthia. So Cynthia is going to talk to you about the dangers of drug abuse and all that, the package of drug abuse, okay? So let's clap for her as she comes in, okay? Guys, clap! Thanks. Good afternoon. Good afternoon. As Natasha has introduced, I am Cynthia Tonui. I am a compliance officer from NACADA, Nakuru branch. Ofisi zetu ziko hapo Regional Commissioner's Office, hapo penye PC alikuwa. So I'm from NACADA. Sijui if someone knows the full name of multi-agencies like KRA, KEBS, to try and reduce the use and supply of alcohol and drug abuse. And in collaboration with lead agencies, provide and facilitate the development and operation of rehabilitation facilities. So we also, sometimes we go and inspect rehabs to make sure that they are compliant with the rules that NACADA has. So today I'm going to talk to you about the different drugs and facts. Of course, the commonly known drug that is abused is alcohol. Sijui kama there's other drugs that you know. Mira. Jaba, Mogoka. Yes, my friend. You know, I'm learning new things. My friend at the back there, amenipatia sijui ngale is cigarettes. This is, you see now. This is why NACADA goes to places like this, so you can tell us these names that are being used. So cigarettes, kuna ngale, nimeambiwa bang, siku hizi inaitwa boza. During my time, I'm a millennial, ilikuwanga ndom. So saizi sijui inaitwa boza. Gunga ni gani? Itabidi I meet some of you muniambie hizi majina. Yes, the guy in the cap, ulikuwa raise your hand. Ama cocaine. Ngete ni nini? Kede.
Kete. K-E-T-E.
Oh, kete. Kete ni nini? Oh, hiyo ni heroin. You see, I'm also like no, this one. Unajua sasa I'm an officer, nitakushika basi. Huyu nitaenda na yeye. Tutaenda. So ni alcohol, tobacco, miraa. Huyu anafanya hapa kuber, bang, prescription medicine. Unajua you can go and when a doctor prescribes medicine to you, it's fine. But sasa ukianza ku abuse, your drug abusing that particular drug, narcotics like heroin and cocaine. So alcohol is a depressant that comes from organic sources. My friends, kwanza wewe ni target audience. Alcohol is a depressant that comes from organic sources like grapes. So grapes inatengeneza vitu kama wine, grains, berries, and when fermented or distilled into a liquid. The main active component of alcohol ni nini? Ni depressant. So unaona kumbe mnajua, because when you take alcohol the next day, hizo mahangs huwa inawagonga. Una feel depressed, uko anxious. So it's a depressant. The main component of alcohol is ethanol, and it kills more teenagers than all the drugs combined. Youths who drink maybe 7 times are more likely to use other illegal drugs than someone who does not drink. Kwa sababu ukikunywa, unajua unataka kufeel your high. So mtu akikupatia kitu kama bangi, akwambie sasa hii itakupeleka even more, utachukua, si ndio? But someone who's sober, akipresentiwa these drugs, they're not susceptible. Okay? Yes. And sijui kama I think it was a month ago, muliona NACADA came up with certain policies, proposals. Yes, can you tell me one of those proposals? Yes, but I think that one was already in the laws, ni vile kwa enforced. But what was the main contention? Enye watu walituattack sana, 21 years. Kuna watu wako less than 21 here? Oh, there's a young lady here. Oh, Natasha. And why do you think Kenyans were so angry about moving the age from 18 to 21? Appetite? Yes. Yes. Why? Because the body has not. Yes. Because you have not matured. Yes.
So the same way.
That's a different story. Moving out is different. But the brain, wacha nikwambie scientifically, the brain, kuna kitu inaitwa the prefrontal cortex, and that's the control center of the brain. Sawa? Hapo ina control emotional regulation, impulse control, na nini nyingine, decision making. And that part of the brain is usually the last one to develop. Na inafika mature at what age? Yes, 25. Ngoja hiyo, mimi nimekuja mambo ya drugs na pombe. So, what that means is, when someone, kwa sababu from our studies, even kids as young as 6, wameshaanza kunywa pombe. What that does, if you start early before 25, it means it impairs it suppresses your brain to develop fully. Sinona. And people who start earlier than 25 at a higher risk of addiction from our studies. Yes. If you start earlier than when your brain has developed fully, you're at higher risk of substance use disorder and addiction. So that's why, as NACADA, we were like, unajua Kenya, we have this reputation of being a drinking nation. Tukienda TikTok, and then there's someone who's listing down the most alcoholic countries in Africa or in the world. Kenyans tunafurahi tukiona number 1. Ukiingia comment section, Kenyans tumeweka bendera, yes. Ama tukiweka number 3 tunakasirika. Why? Ona, kama alafu tunafurahi. But this time we have to take health seriously, and we have to take care of our future generation. Sunaona? Kwa sababu we should not be looking at the revenue ama to look cool ama we have to take care of these children. Yes. Kichele ni nini? Hapana. I think when I came in, nilisikia Natasha akiwaambia, was it several ways of dealing with stress? Ama? You are talking about that. Umesema kama mtu amekusumbua. Kama uko na stress, don't go to alcohol. Kama uko na pesa, invest. Fanya something. You can do other things. I'm just saying, don't drink. Don't do drugs. Okay? Yes. Yes. To an extent, yes, because yes. But let me ask you something. How did you get to excessive? It started with one drop, a drink. Ilikuwa, you wanted to taste. And then you see, alcohol and drugs affect everyone differently. Depending on your family background, where you're coming from, it affects. Sasa hawa wawili wanaweza kuwa wameenda. Huyo influence huyu achukue shot moja. Huyo amekuwa kikunywa for 10 years haja affectiwa. Huyu within a year akunywe atakuwa addicted. His life is ruined. Apate liver cirrhosis. And then the thing we don't realize, alcohol na drugs haiku affect wewe peke yako. It affects the people around you. And I'm sure everyone in this room has been affected by alcohol and drug abuse. Hata kasi wewe. You know a family friend, you know a family friend, you know someone who's been affected by alcohol to even lead to death. And I think at the end I will tell you a personal story. That's why I'm very passionate about this. Sawa? Yes? We usually do. Jayona. We will look into it, but I think we usually do. For us to even come up with these policies, we usually yes. Sasa, you know, alcohol is a legal drug in no, it is not. No, si ndio maana wewe nimekwambia tunaenda na wewe. Tunaenda na wewe. Yes? No, we have to tell you the repercussions of what we'll take after you take that alcohol. Unaona? Yes, exactly. Kuna mtu mwenye hajui? No, I've seen even a little child here. We have to make sure. Ndio maana niliwaambia our mandate as NACADA when I began this session is to create public awareness. Ndio sasa saizi kwanza leo ni Friday. Ukitoka wende ushike okota yako, you know the repercussions. Is that okay? Na side mumenyamaza. Kiswahili pati mafuta kwa liver. Kwa maini. So chronic alcohol use may result in memory loss, impaired judgment, headaches, depression, anxiety, blackouts, and insomnia. I think some of you usually think if you take alcohol you'll be able to sleep, but around 3 unaamka. It can cause cancer of the esophagus, upper mouth and throat, heart disease, high blood pressure, stroke, impotency, reproductive disorders. Si mulikuwa mmeona kwa news kuna section in Kenya watoto wameacha kuproduciwa. Si mnajua mbona? Lack of ni lack of men. Men are there, but the men are there, but why? The men are there. Ni pombe. Men are there. But wakifika nyumbani kazi haifanyiki. Inashindwa kuamka. Pombe watu wanalala chini ya kitanda. So si uoga, haiwezi fanya kazi. So mwache pombe. Muscle damage. Mtu amechukua kwanza pombe ndo anakuanga na confidence than mtu ako sober. So sijui unasema nini? Hapana. Mimi nawaambia tu muache ndo muweze kufanya kazi. Poor health and hygiene. Loss of sight. There are so many cases of unaenda unapata pombe cheap. This is illicit brews unakunywa. Simesikia kuna watu wanakuwa vipofu. So that's one of the side effects. Staggering. And the final, after yoyote umepitia yoyote, ni death. Utaenda kuona baba. Sijasema ati mkunyo yoyote, but at least imepitia government chemist. It has been certified, but sisemi mchukue eni. Musiende enye aija. Huyu ameniuliza hii sasa hatuja certify, hatuja test if it's hii ichanga yako. Hatujaenda kuangalia if it's safe for human consumption. Sindio? Hata this illicit brews zenye mnakunywanga, mnajua vile inatengenezwa? Mnajua ni nini na kwangu huko ndani? Mnajua? Ukiamka kesho kipofu. And then the ladies, if you're pregnant or you're planning to get pregnant, please do not take alcohol. Kwa sababu alcohol impact the baby's brain. So mtoto anaweza toka na issues, brain development, ako slow. Inaweza result in physical defects known as fetal alcohol syndrome in children. Children born to women who have taken drugs during their pregnancy may be stillborn or afflicted with multiple birth defects. So you should avoid, as a pregnant woman, you should avoid all drugs including alcohol. Ngekuwa na project and ngeonyesha some of the pictures. Alafu sasa kuna wale wenye they should not even drink at all. Au ni recovering alcoholics. If you're struggling with alcohol, umepelekwa rehab, please do not be tempted to go back. Kwa sababu alcoholism is a brain disease. It cannot be cured. It cannot be cured. All we can do is prevent it and manage it. Sawa. So the different types we can try and manage it is including therapy. Find a therapist or talk to someone you trust. Yes, you can talk to Natasha. Ameshawapatia those tools, journal, unajua. And ukiona you're craving, just call a friend. Ama kuna easy support groups, Alcoholic Anonymous, join them, find a rehab. and deal. Hata NACADA, by the way, you can call NACADA. We have a free helpline, 1192. It's free. They have counselors. So kama unapitia anything in life, and it's anonymous. No, you can call the helpline if you're struggling with anything. You can talk to a counselor. Na pia kama unajua these hotspots, you can call na itakuwa anonymous. No one will victimize you. Sasa kwanza men, please open up. Don't go to the bottle. Because I think the society has made it seem that when men speak up, you're weak. You're not weak. Okay? You're human beings. You're going through life. Kuna vitu munapitia. You're the providers in your family. Now maybe you don't have the resources. Just talk to someone, ata a friend, someone you trust. Na kama if you're surrounding yourself with people that you cannot talk to about what you're going through, those are not your friends. Sawa, think about it. We have one in Miritini for NACADA. NACADA yetu ni Miritini, and then Mombasa, Miritini Mombasa. Alafu kuna government, kuna yeniko Eldoret, I think Nairobi, there's one. But if you want to see our rehabilitation centers, you can go to our website. They're all listed there. Kama you'll have to find the government ones. Kama Eldoret ni government and it's cheaper, but the private ones are very expensive, and that's why I'm saying prevent. Yes. Yagava, no. Yeah, the private ones. I think there's a small fee, but it's uneza enda. Ndo maana nawaambia stop drinking. Ka unaweza saizi, kwa sababu sasa rehab you're bringing your family wafanye mchango wakupeleke. So hii kitu yenye ulikuwa unataka enjoyment for yourself affect everyone, your kids, your uncles, your parents. Sawa? Ngoja welcome me. Ama Kozuya alikuwa amesema tumalize and then I take the questions. Since huyu alikuwa amesema women's bodies have proportionately less water than men's bodies, so we are affected more than the men. So, alcoholism is a chronic, often progressive disease, and it has a generally predictable cause and recognized symptoms. Symptoms ni craving, a strong need, compulsion to drink. You can't stop. Unansmile uko na craving. Loss of control, the inability to limit one's drinking on any given occasion. Ukisema umeendea bia mbili, alafu you end up unarudi the next day, pesa yote imeisha, unaokota kutoka mtaro. Those are symptoms. Physical dependence, ukiacha pombe unaanza una shake, lazima utoe lock ndo ukwe sawa. I'm in this field. I'm in the netanga ground, lazima utoe, bas unashindwa kulala, uko na hang. Sikuizi naona Gen Z wanaita anxiety, si ndio? Unaanza kufikiria nilifanya nini jana, nilisema nini, ukiangalia calls, nilicall nani, pesa ulitumia yote, ulikula rent. alafu tolerance. Ndo hizo sema tu zote hizo ni symptoms of alcoholism. Tolerance, kitambo ulikuwa unaanza na shot moja ama 3 shots, unasikia siku hizi mzinga hata umesimama tu, unaona. So the more you take, tolerance yako, hizo ni signs of alcoholism. And then alcoholism is influenced by both genetic and environmental factors that are being increasingly defined. So, kama mimi personally, my family is genetically predisposed to alcohol. I have lost uncles, recently I lost a cousin to alcohol. Na yeye ilianza tu, unajua, after job anaenda na workmates, twende tuchukue kimoja, na alikuwa baba ya mtu. So because the society has normalized the men asifike kwa nyumba mapema, si ndio? Akitoka kazi lazima apitie mahali. So he didn't notice, it crept up on him. Na it made him lose his job. Alikuwa na work in a very reputable bank. He lost his job. After job imeisha, sasa tunaona he's a provider, he has a family. Stress inamkula. Ako free Monday to Monday. Anakunywa. The next morning anasema, ukimuuliza unapata kuota kwa nyumba, unamuuliza saa 2 asubuhi, ati natoa lock. Unaona, and you know uni mtu mwenye anajiweza. And life within 6 months liver yake ilianguka, and he had to be flown to India. And one of our cousins, kila mtu, the male cousins, walitestiwa liver zao. Na tunaona sasa ni cost, kwa sababu lazima wapelekwe, waflaiwe India, watestiwe if they are compatible to apewe liver. So livers unajua wana slice ndo ampatie. But during surgery wali notice his liver was hakuwa na liver hapo, but still they planted. After surgery akaingia ICU. After ICU walisema hiyo liver haikutake, because liver yake yote ilikuwa imeisha, and he passed. So these are things, kwa sababu ni mtu mwenye amesoma, amefanya kazi, and he didn't see it creeping up on him. Na ime affect the whole family. Nona, not just his immediate family, it affects the extended family. So please let us take this seriously, and if you come from a family that maybe it's predisposed, please be careful with alcohol. Usifuatane na marafiki. Maybe rafiki yako anaweza take it, wewe tukuje tukuambie kwa heri. So another thing that influences alcoholism is a person's environment, your friends. Vile nimewambia, kama you can't open up to your friends, ama the people you surround yourself with hawakupeleki mahali maisha, you don't speak about constructive things. Please change your friends, kwa sababu hii maisha ni yako. You have to take control of your life. Usisikie kenye watu wengine wanakuambia. Kaa chini na wewe. Anasema ndo nasema kama hamwezi influenciana, Monday to Monday mnaokotwa kwa mtaro. Hakuna mtu mwenye anasema si pombe imekuwa enough. Si ndo nasema pia wewe peer stress levels, ease of obtaining alcohol may influence drinking. Hivyo ndo tumesema, addiction, you can't be addicted if you never started drinking, ama? You can't, kitu people don't notice, unafikirianga, it can never happen to me. si ndio? Unaonanga hiyo ni shida ya watu wengine. But the moment you take your first sip, you're at risk of addiction. That's what I'm saying. So tumemalizana na mambo ya pombe, and I think maybe I'll take a few questions ya pombe. Ya pombe.
Wanasemanga ati pombe inaua pole pole. Sasa mbona utake kufa haraka? Asema pombe inaua pole pole. Tunakunywa ndo usikufe haraka.
Sijaelewa Tindo. Sijaelewa hiyo swali. Kwa nafaa kuuliza.
Okay. Hello. Okay. I'm another. So there's a question I'm gonna ask. Let me tell you for the truth. Maybe I'm a lecturer. I cannot teach don't drinking. I must teach and restaurant. Okay. Next, I am a doctor.
Yes.
I cannot. Okay. And another one. Before I deal the spanner, I need to have a drr. And before I sign a check, I must have a drr. So, okay, before I sleep, without doing it,
Sunaona tulisema one of the side effects of alcohol is slurred speech. Mtu haezi ongea. Kuna case study hapa.
Ulize swali mbona unasema?
Anasema muniulize.
Mimi nikuulize?
Particular. Sawa.
Sasa walevi sio wengi, walevi ni mimi peke yangu. Na hiyo siku yote mimi naendesha bodaboda na sijai kuwa hivyo.
Unaona mbona unaendesha bodaboda ukiwa umekunywa? Unaona?
Unafunga kazi.
Umesema unaendesha bodaboda, so you're putting someone else. Unaweka maisha ya mtu kwa danger kwa sababu wewe lazima ukunywe pombe.
Mimi nikienda nyumbani naenda peke yangu.
Hapana, umesema unafanya bodaboda?
Lakini
kwa hata saizi naweza sikia. Na msho umebeba watu.
Kuja nikubebe basi tuone kama uwezi fika. Kuja twende.
Mimi nataka uache.
Niache hiyo pombe?
Wachana nayo.
Haya, nikubali basi. Tukae nayo.
Kati.
Sasa kila kitu utaki.
Mimi hebu. Aya, are there any other questions? Alcohol? Huyo huko.
Sina swali tunataka kuuliza.
So the next thing we are going to talk about ni tobacco. Na as my friend here ameniambia inaitwa ngale ama fegi. Fegi najua, ngale sijui. Tobacco sasa sijui niseme kama ni worse than pombe, but it kills half of its users. Half of its users cigarettes. Tobacco, World Health Organization walifanya study and they came up with the figure 8 million. Tobacco kills 8 million people annually. 8 million. And more than 7 million of those people ni from direct smoking. Si mnajua pia mtu akismoke karibu na wewe, hiyo ni indirect and it can affect you. So mtu anaweza guess, because nimesema inaua 8 million annually. And then 7 million ni from direct smoking. inaua more than 1.2 million from people who do not smoke but are indirectly affected. 1.2 million are the result of non-smokers being exposed to second-hand smoke. So ukiona mtu anafuta sigara, it can still affect you. As I do not endorse violence, so mwambie tu aende nje. Nearly 80% of the world's 1 billion smokers live in low and middle income countries. Most commonly consumed in the form of smoking, chewing, or sniffing. Most active ingredient in nicotine, which is highly addictive, leading to tolerance and dependence. So nicotine pia inapatikana kwa vape. Kwa sababu I'm seeing like vape imekuwa very common and people think that it does not affect them. But the main ingredient in vape is nicotine. And nicotine is very addictive. Tumeona hata siku hizi kuna cases of collapsed lung from use of, si ndio? In adults, second-hand smoke causes serious cardiovascular and respiratory diseases, including coronary heart disease and lung cancer. In pregnant women, it causes low birth weight. Chani nijaribu kuharakisha. Wacha nimalize ku present kwa sababu ya time. Wacha tutasikia testimony baadaye. So wacha marijuana, bang, nasikia ni boza, gunga, kindukulu, ngwai. The effects are distortions in the sense of time, vision, and hearing, increased heart rate and blood pressure, bloodshot eyes, decreased muscular coordination, poor depth perception and tracking, school and job performance reduced through impaired memory, difficulty thinking and solving problems. Sometimes you can get panic attacks as well. False confidence and well-being, short memory loss, confusion of past, present and future, hallucinations, hizo yenye alikuwa nasema kuona sijui mashetani ama nini, paranoid feelings, inability to form memories, so even when you're hanging out with people unaweza sahau, impaired information processing, shrinking of the brain, and long-term heavy use can cause harm to the reproductive health. That is lower testosterone, reduced sperm quality, and contribute to sexual dysfunction. Hiyo ni long-term use, so be sure of the things that you put into your body. Long-term use can harm reproductive health. Lower testosterone, reduce sperm quality, and contribute to sexual dysfunction. So vitu mnachukua, please make sure you know what you're putting into your body. Long-term effects ni worsen symptoms of bronchitis and cause coughing and wheezing, reduce body's ability to fight lung infections and illnesses, reduced energy and ability to concentrate. At high doses, acute psychotic reactions in susceptible individuals, including triggering chronic schizophrenia in those genetically predisposed. So mumeona cases where people smoke bang alafu wana chizi, si ndio? Hiyo ni kama exactly, so unaona different people are affected differently. Kuna miraa cat, hiyo inaitwa cat, is a natural stimulant from the plant Catha edulis. It is so miraa na jaba ni tofauti. Alafu effects of miraa: increased pulse rate and blood pressure, insomnia, palpitations, blood visions, agitation, increased body temperature, paranoia, decreased appetite, vomiting. And then the long-term effects ni depression. Psychological symptoms of prolonged use are characterized by paranoia, hallucinations, loss of appetite, oral inflammation kwa sababu unaikula, insomnia, impotence in men, and frigidity in women, and that is lowering of production of hormones. That's in women. Long-term chewing can damage male sexual health, leading to reduced fertility, weak erections, hormonal imbalance, which might increase the risk of problems like spermatorrhea. Spermatorrhea ni ile sperms inatoka peke yake, and it's not during sexual activities, inatoka tu peke yake. Alafu there is heroin. How long? 2 minutes. Chatuonge heroin, you can be snorted. Effects of heroin ni warm flushing of the skin, severe itching, dry mouth, nausea, vomiting. Pregnant women can suffer spontaneous abortion, slurred and slurred speech, droopy eyelids, collapsed veins kwa sababu unadunga kwa vein and it gets damaged. So lung complication, liver and kidney disease, mental health problems, so depression, anxiety, mood swings. Simeona kuna a constant in all the drugs, kuna hizi enye ni common side effects. And then sharing of needles increase the risk of infections like HIV, hepatitis B and C, bacterial and heart infections. The withdrawal symptoms of heroin need drug craving, restlessness, muscle and bone pain, insomnia, diarrhea and vomiting, cold flashes pia. Alafu prescription, I think nilikuwa nimeongelea prescription drugs. You can also abuse. Sasa umepewa dawa na daktari, please take it the way the doctor has advised you to take it. Sawa, na pia kama rafiki yako ndo amekuwa prescribed a drug, don't use it. Unaona? Kwa sababu these days unaona kama mara moja ukiwa na hangi unachukua tu mara moja, you are abusing that drug. Na the long term effects of many painkillers zenye amjui mbona mkuklap kwa the men, don't do that please. And I think I'm done, but the addiction process, kuna process that of course you have to start from somewhere, and that's experimentation, first use. So the first time you use something, alcohol, bangi, ama heroin or cocaine, umeanza hiyo process ya kufika addiction. It might seem small, kablant kadogo, kashot kamoja, you've started, umefika process number 1. The second process is regular use. enye every weekend boys wako ama the girls wamewacall muende mahali munatumia. And then there is risky use. Risky use ni kama unakunywa and then you go and drive, ama you take advantage of someone, ama unaona, that's risky use. That's number 3 in the process. And then there is dependence. Hawezi enda kazi bila shot moja ya tequila ama so umefika stage 4 of the addiction process. You can't function. Number 5 and the final stage ni addiction. Unatembea na quarter job, unaweka kwa chai, unaweka kwa coffee, ukiacha unatetemeka. Unaona, you can't function. And the last stage of addiction is death. So please, as NACADA, we're not saying, what we are saying is you have to know the process. Your shot ya kwanza, it might seem harmless. It might seem harmless, but it leads to sudden death. Na hii kitu ya alcohol and drug abuse does not affect you alone, it affects your people. Wewe ziona kama uko na familia, hao ndo watakuchangia uende rehab, hao ndo watakuwa na kuokota kwa mtaro. How do you think that makes them feel? It's not affecting you. Wewe sayo maybe black out, wakikwambia haukumbuki, when they try and approach you, you get irritated. Unasema ni maisha yako. But these are people who love you. And please, if you have a problem or you know of someone, as I said, our number is 1192. You can call anytime and it's free to call. If you're going through something, ama hata kama munajua hotspots of these drug dealers, call us so we can nab them. And it will be anonymous. You will not be victimized for providing that information. And if you want to visit us, our offices are in Regional Commissioner's Office, 2nd floor, Block A. Thank you for your time and engaging with me.
Yes, thank you so much. Mpigie makofi tena. I think imekuwa sawa. At this juncture, nitamkaribisha chairman. Oh, sorry. So, our chairman had a question na atazungumza.
Si hata chairman yaulize swali? Mimi nataka kuuliza hii swali. Mimi nikiwa mtoto mdogo, bangi ilikuwa inapandwa kwetu. Kisii ilikuwa kama maua. Si kuchua bangi ni kitu mbaya, kwa sababu nilikuwa nalala chini ya bangi wakati jua iko kali. Lakini nilikuwa naona baba yangu akifuta, na alifuta kwa miaka mingi, na sio hii vijana wanafuta. Nilikuwa na kakibuyu na kitu kingine juu, kuna maji ndani, kuna mawe na moto. So alikuwa anafuta, alafu alikuwa anakuwa na raha sana wakati amefuta. Akienda kwa shamba lazima tuende kumtoa, aistoka analima tu. So nataka kujua tofauti gani hiyo, kwa sababu inaonekana kuna tofauti, lakini ukweli bangi sio mzuri. Siku moja sisi kama vijana sasa wadogo tulikuwa na hamu ya kuifuta. So tuliiba hiyo vitu yake, tukaenda karibu na kwa jirani, tukafuta huko. Lakini huyo jirani alikuwa na umbwa 6 kali sana, zilikuwa zinakimbiza sisi. Kitu ya ajabu, siku hiyo wakati tulifuta, wakati hizo umbwa zilitoka upande ya mbele, kuliko sisi kutoroka nyuma, sisi pia tukaenda mbele mahali zinatoka. Hata hizo maki niko nazo hapa sichapotea, niliumwa na hizo umbwa. Kwa hivyo bangi sio kitu mzuri. Unasikia niko na maki mpaka saa hii, lakini hiyo ya baba yangu sikuelewa alikuwa anafuta miaka.
Oh, I think vile nimesema bangi ina affect everyone differently. Huyo anaweza smoke for 5 years, wewe 1 month akili ende. So it's ina affect different people differently. And alafu what we've noticed na ya siku hizi wanaweza kuwa wame add other things like cocaine na unaona other drugs, ndio maana si kama ya kitambo, but bado bangi si mzuri. So thank you.
Mpige makofi tena tafadhali.